Hey guys, so today I wanted to talk a little bit about hip mobility, okay? In a prior video I had discussed thoracic spine mobility throughout our upper back, okay? Today I want to talk about the core of our body, the center of our being in relation to your hips, okay? The hips are the focal point for any movement that we do, okay? I've noticed with a lot of people that I've worked with, they complain about lower back pain, complain about not being able to get down in their squats, complain about not feeling like they're able to strike a ball effectively on the soccer field, okay? A lot of that relates to, as a very general term, hip mobility, okay? So I want to talk a little bit about that and how maybe I could help you guys decrease some of that lower back pain, maybe be a little bit more effective as an athlete. If you're just trying to stay in good shape, squatting, might be able to get a little bit deeper in that squat without having pain in our hips or our lower back, okay? So to do that, I want to talk about the general movements of a hip, okay? First, we got hip extension, okay? That's driving our legs straight back, coming into extension, all right? Then we have hip flexion, bringing the knee all the way up, okay? From there, we want to talk about hip internal and external rotation. To understand hip internal and external rotation, we got to understand that our hip is a ball and socket joint. So the femur, our thigh bone, sits right in the socket joint capsule, okay, right at the top of our hip. And from there, it's the rotation of the femur internally and externally. Okay, so if we're coming up here, external rotation of the hip is going to be in this position, internal rotation of the hip is going to be in this position. Okay, two other movements of the hip is going to be abduction of the hip and adduction of the hip. Okay, hip's the primary mover if we're opening up on the soccer field, on the basketball court, moving laterally, okay, generating power. We need to have good hip extension, good hip mobility. Okay, to talk about a very basic hip extension drill, we want to be able to drop our knee back. Okay, from here, think about keeping your hips facing forward, all right? Avoid having excessive curving in your lower back, okay? Make sure that we have a straight, flat back, upright chest. Then you're gonna slowly lean the hips forward, engaging that back glute as you're pushing that hip through, okay? From that position, we gotta think about mobilizing one of our primary hip flexors, our psoas. Think about reaching over that front leg and extending. You're gonna hold for about 5 seconds, and then you're gonna slowly come out of that, and then you're going to come back in, hold for about 5 seconds. Okay, that's really working on some good hip extension. Okay, a second hip mobilization drill that I want to help you guys work on, okay, is you're going to come into all fours in a push-up plank. From there, you're going to bring one of your feet up by your outside hand. Okay, in that position, you're already in extension of that back leg and flexion of that front leg. Okay, from there, go ahead and drop that back knee down on the ground, increasing both of those movements I just discussed. Okay, then I want to talk about coming into slight internal rotation of the hip, reaching across, and going into extreme external rotation of the hip as we drive that knee outward. You're going to pause and hold, then you can come back down slowly, pause it, open it up, pause it. You'll get about 3 to 5 repetitions, and you'll pick that knee up, put the foot back, switch legs, drop the knee, again, reach across, and then open up. Okay. From there, get about 3 repetitions on each side, okay? And then switch your legs 3 to 5 times. All right. Our last stretch that I want to talk about is getting good internal rotation of our hip. Okay, I already talked about hip extension being a primary movement that we need, and hip external rotation. Now I want to show you hip internal rotation. Okay, here I like to call this one our 90-90 hip stretch. You're going to sit on the floor, upright chest, feet slightly outside your hips. From there, you're going to slightly drop your knees downward, okay? Keep a 90-degree angle between our ankle, our knee, and our hip, our knee, and our ankle. Okay, from there, we're going to be focusing on our top hip primarily. Think about engaging your glute, pushing your pelvis through, feeling the tightness in that hip capsule. From there, opening our arm up, over that front leg, and closing back over. Keeping that same position, you'll get 3 to 5 sets, and then you'll slowly come out, and then you'll switch legs and repeat the same thing. Okay, the goal here hopefully is to decrease a little bit of the lower back pain that some of you may be experiencing, make you more effective in the movements that you do on the field, on the court, or even in the weight room. Okay, we're not talking about flexibility, we're talking about really increasing that range of motion within that joint. Okay, putting yourself in that vulnerable position and making you being able to be mobile, able to be strong. Okay, injury occurs when you're in the end range of motion of a joint and you're not mobile or you're not strong. So hopefully we can decrease that while making you feel a little bit better. Thanks guys.